Have you ever stood up after sitting for a while and felt a sharp pain in your knee? Or maybe climbing stairs has become difficult? Or you hear a crack sound when you bend your knee? If you're above 40 and thinking, is this normal aging? Then this video is for you. Because knee pain is not something you should ignore. And today, I'll tell you why knee pain happens after 40. Early warning signs you should never ignore. Powerful home remedies. When to see a doctor. Latest treatments and research. Stay till the end, because one simple mistake people make daily is silently destroying their knees. Knee pain is one of the most common problems after the age of 40. In fact, most people start experiencing symptoms in their 40s or 50s due to joint wear and tear. But here's the truth. Knee pain is not just age-related weakness. It is often a sign of underlying damage or inflammation. The good news? Most cases can be managed, and even prevented, if you act early. What happens to your knees after 40? Let's understand this in simple language. Inside your knee joint, there is a soft cushion called cartilage. Its job is to absorb shock, help smooth movement, prevent bones from rubbing. But with age, this cartilage starts wearing out. The joint becomes stiff. Bones start rubbing against each other. This condition is called osteoarthritis. It is the most common cause of knee pain after 40. Why does it happen? Main reasons: aging, wear and tear, excess weight, extra pressure on knee, previous injuries, repetitive stress bear, kneeling, heavy work, weak muscles around the knee. Common causes of knee pain after 40. Let's break it down clearly. 1. Osteoarthritis. Cartilage damage. Pain increases with movement. Stiffness in morning. 2. Overweight. Even 1 kg extra weight increases pressure on knees significantly. Studies show weight loss reduces joint stress and pain. 3. Old injuries. Old sports injuries or accidents may show symptoms later in life. 4. Overuse. Repeated bending, climbing stairs, or heavy labor can damage joints over time. 5. Weak muscles. Weak thigh muscles, text, less support for knee joint, more pressure on bones. 6. Inflammation. Conditions like arthritis or bursitis can cause swelling and pain. Early warning signs. Most people ignore early symptoms and regret later. Watch for these. Mild pain while walking. Stiffness after sitting. Crackling sound. Swelling after activity. Difficulty climbing stairs. Reduced movement. Symptoms of serious knee problems. If you notice: severe pain, sudden swelling, knee locking, deformity, fever with joint pain. This could indicate serious conditions. Home management of knee pain. Most people think knee pain means medicines or surgery. But the truth is, in many cases, you can control knee pain at home, and even prevent it from getting worse. All you need is the right habits. Let's make it very simple. 1. Change your daily habits. Most important. Your daily routine can either damage your knees or heal them. Avoid sitting on the floor for a long time, squatting, like traditional toilet position, climbing stairs again and again, sitting cross-legged, sudden standing after long sitting. Do this instead. Use a chair instead of floor sitting. Use a Western toilet if possible. Take support while getting up. Move slowly, don't rush. Small changes are big relief. 2. Keep moving but don't overdo it. Many people think, take some rest to relieve pain. Wrong. Too much rest makes your knee more stiff and weak. Best approach: move regularly, but gently. Easy daily movement plan. Morning, 5 to 10 minutes slow walking. Day, avoid sitting more than 30 to 40 minutes continuously. Stand and move a little. Evening, light walk or stretching. Rule: motion is lotion for joints. Movement keeps joints lubricated. 3. Simple exercises are: strong muscles have less pressure on knee, no need for gym. Do these at home. Exercise 1, straight leg raise. Lie on bed. Keep one leg straight. Slowly lift it. Hold 5 seconds, lower it. Repeat 10 times each leg. Exercise 2, chair knee extension. Sit on chair, slowly straighten your leg. Hold for few seconds. Bring it down. Repeat 10, 15 times. Exercise 3, wall support. Standing. Stand with support of wall. Slightly bend knees. Hold 5, 10 seconds. Important. Do slowly. Stop if severe pain. Be regular. 4. Weight control. This is one of the biggest factors. Every extra 1 kg body weight is 3 to 4 times more pressure on knees. Example, if you lose 5 kg, your knees feel like you lost 15 to 20 kg pressure. Simple tips. Reduce sugar. Avoid fried food. Eat smaller portions. Walk daily. You don't need dieting, just balance. 5. Hot and cold therapy, very easy and effective. Cold therapy, use when swelling, recent pain, after activity. How? Wrap ice in cloth. Apply 10-15 minutes. Heat therapy. Use when stiffness, chronic pain. How to do? Warm towel or heating pad. 15 to 20 minutes. Simple rule is 4. Swelling, use ice. In stiffness, use heat. Oil massage. Massage improves blood flow and cause. Muscle relaxation, stiffness, use. Mustard oil, olive oil, coconut oil. How to do? Slightly warm the oil, gently massage around knee. Do not press too hard. Best time before sleep. 7. Knee support and footwear. Knee support, use. Elastic kneecap, brace, need, helps. Stability, less pain during walking. Footwear, very important but ignored. Avoid hard sole shoes, high heels, slippers without support. Use soft cushion shoes, proper grip footwear. Good shoes check less knee stress. 8. Diet for healthy knees. Food plays a big role. Eat more. Anti-inflammatory foods, turmeric, ginger, garlic. Healthy foods, green vegetables, fruits, nuts. Protein and omega-3, fish, eggs. Dal. Avoid fried food, excess sugar, soft drinks, junk food. Simple rule, eat clean, joints stay healthy. 9. Simple home remedies, turmeric milk. 1 glass warm milk, turmeric, helps reduce inflammation. Epsom salt soak. Warm water plus Epsom salt. Soak legs for 15 minutes. Relaxes muscles. Ginger tea. Natural anti-inflammatory. Important, these help in mild cases, not severe disease. 10. Rest, but smart rest. Rest is important, but too much rest is harmful. Do. Take short breaks. Elevate legs when resting. Don't. Stay in bed all day. Completely stop movement. Balance is key. 11. Posture matters. Bad posture causes extra stress on knees. Correct posture. Sit straight. Keep feet flat. Avoid bending knees too much. 12. Daily routine plan. Morning, light stretching, 10-minute walk. At day, avoid long sitting. Move every 30 to 40 minutes. Evening, exercise and walk. Night, warm oil massage or heat therapy. Follow this daily, causes major improvement. Important warning is, home management works for mild to moderate pain, but not for severe pain, injury, swelling with fever, deformity. In these cases, see a doctor. Taking care of your knees is not difficult. Small daily habits, regular movement, healthy weight can save you from lifelong pain or surgery. When to see a doctor. Don't ignore these signs. Pain lasting more than few days. Increasing swelling, difficulty walking, injury or fall. Fever with joint pain. Early diagnosis has better recovery. Medical treatment of knee pain. If home remedies are not enough, don't worry, many medical treatments are available. And most people improve without surgery. The key is early and proper treatment. Let's understand everything step by step in very simple language. 1. Medicines. Doctors usually start with medicines to reduce pain and swelling. Common medicines. Pain relievers. These reduce pain so you can move comfortably. Examples: paracetamol, ibuprofen, diclofenac. These are very commonly used. Anti-inflammatory medicines. These reduce swelling inside the joint. Helpful when knee is inflamed. Important warning. Do not take painkillers daily without doctor advice. Long-term use can damage stomach, kidneys, heart. Always take medicines only as prescribed. 2. Gel and local treatment. If pain is mild or moderate, doctors may recommend pain relief gels, anti-inflammatory creams. How to use: apply on knee, gently massage 2 to 3 times daily. Advantage: less side effects than tablets. 3. Physiotherapy, very important. This is one of the best treatments for knee pain. What physiotherapy does: strengthens muscles, improves movement, reduces stiffness, prevents worsening. What physiotherapist may do: teach special exercises, use machines, ultra therapy, improve walking style. Important: many people skip physiotherapy, but it can delay or even avoid surgery. 4. Knee injections. If medicines don't work, next step may be injections. Don't worry, these are common and safe when done properly. Steroid injection reduces pain, swelling. Effect: relief for weeks to months. Note: not used frequently. Too many injections can harm joint. Lubrication injection works like oil in joint. Benefits: improves movement, reduces friction, helps in early arthritis. PRP injection uses your own blood. How it works: blood is taken, special part injected into knee. Benefit: helps healing, reduces pain. This is becoming popular in modern treatment. 5. Supportive devices. Sometimes doctors recommend knee braces, support joint, reduce pain during walking. Walking stick. Very helpful, but people feel shy. Truth is, using a stick reduces pressure, prevents damage, improves balance. Use it on opposite side of painful knee. 6. Minor procedures. If pain continues, doctors may suggest small procedures. Arthroscopy, small camera inserted into knee, used for cleaning joint, removing damaged tissue. Benefits: small cuts, faster recovery. Not for all patients, only selected cases. 7. Knee replacement surgery. This is for severe cases only. When needed: severe pain, cannot walk properly, daily life affected, other treatments failed. What happens? Damaged joint is replaced with artificial joint. Benefits: pain relief, better walking, improved quality of life. Recovery: walking starts in few days, full recovery in weeks to months. Modern surgeries are very advanced and successful. New and advanced treatments. Medical science is improving quickly. Stem cell therapy, special cells used to repair damage. Regenerative medicine, focus on healing joint naturally. These are still developing and may not be available everywhere. 9. What people do wrong, very important. Common mistakes. Taking painkillers daily on their own. Ignoring pain for years. Delaying doctor visit. Believing only in home remedies in severe disease. Result: condition worsens. 10. Simple treatment flow, very easy to understand. Step 1. Home care plus exercise. Step 2. Medicines plus physiotherapy. Step 3. Injections. Step 4. Minor procedure. Step 5. Knee replacement. Most people improve in Step 1 too. Latest research and advances are: modern medicine is evolving fast. Some exciting areas: regenerative therapy, stem cell therapy, PRP. Aim is repair cartilage. 2. New medications, targeting inflammation and slowing joint damage. 3. Personalized treatment, treatment based on genetics and lifestyle. 4. Advanced implants, better knee replacement designs, sex, longer life. Prevention is: want to avoid knee pain? Follow these. Maintain healthy weight. Stay physically active. Strengthen leg muscles. Avoid sitting too long. Use proper posture. Wear good footwear. Avoid sudden heavy exercise. Prevention is always better than surgery. Biggest mistakes people make. Avoid these: ignoring early pain, taking painkillers daily without advice, complete bed rest, sudden intense exercise, not losing weight, Conclusion is, knee pain after 40 is common, but it is not normal to suffer silently. Your body gives early warning signs. If you listen early, you can avoid serious damage. Take care of your knees today, so they can carry you tomorrow. If you found this video helpful, like this video, comment, knee care, subscribe for more health videos, and share this video with your parents because they might be silently suffering